really push professional behaviors. We really push being attentive to your patients and listening and being compassionate and understanding. From what I hear from clinicians, that seems to take, that people really like our grads.
I did the exercise science route with a focus in the clinical. I wanted a parachute plan, I guess you could say, if I didn't get into PT school right away. So I did an internship in cardiac rehab and gained real life patient care skills, and then applied to PT school and luckily got in.
I just like the faculty and how they really care about what they're teaching. They really care about how you're doing as a student, how you're doing as a clinician. They really take the time to explain things if you ask.
Everyone treated you like you were a person and not a number. That's kind of what caught my eye.
We have a class of 60 students currently, and all 60 are together in the summer. They all get together to get to know each other. They also can take the anatomy class together, those kind of things. And in the fall, 12 of them will move to Houghton, Michigan, in the Upper Peninsula, and that's where they take classes. This is an interactive simulcast, so they're in class at the same time. Students have to present in Mount Pleasant, cameras are on them, and when groups turn in Houghton, cameras are on them. And it works really quite well. One of our missions in our program is to train therapists to work in underserved areas, and rural is it. And we are the most northern program in Michigan, so it was a really easy transition to add a satellite in Houghton because they really have a hard time hiring therapists to work in the Upper Peninsula. We've had a new faculty member join us in the last few years, and she has started what's called the Move for Health class. It originally started for people with Parkinson's disease, and it's an exercise class that's held once a week. They've now expanded it to include individuals with multiple sclerosis, and the students schedule the time, they run the class sessions, the treatment sessions, things like that.
Hands for Health is a student-run clinic here at Central Michigan University, and is run by our second-year DPT students. And so there's 3 years in our program, and in their second year you have the opportunity to run this clinic. And what the patients are is if they've exhausted their PT clinic services, or if they don't have any insurance at all. So it's a way that they don't have to go to pay for out of their pocket for their PT services. For the student physical therapists, they're a second-year student, and so this is giving them more patient care experience.
The American Physical Therapy Association has a House of Delegates, and basically just imagine like Congress for physical therapists, and that's what it is. So what I did was I went out there, and as a house usher, I basically just ran messages back and forth from delegation to delegation. And not only did I get to see how policies get put into motion within the APTA, I also made a lot of connections.
In order to get in the program, you have to do lots of job shadowing, and so I shadowed a various amount of clinics, and I've always found that people who had Central students, they always said that they were very prepared, they were very knowledgeable about just coming in as students, and when I came here, I can definitely see why.